Hello and welcome to True Pathfinder, your portal to health and truth. Alzheimer's disease is a chronic degenerative condition that is considered by mainstream medicine to be incurable and whose origins are unknown to this day. So, what are the causes of Alzheimer's? Can we figure it out? And is there really no solution? Well, let's take a holistic look at all of these subjects and figure it out. Let's start by discussing the causes, starting with the one that is most often overlooked, and that is the psychosomatic side of things. The psychosomatic unexpected shocks in your life, such as separation conflicts that are experienced as a loss of physical or non-physical contact or wanting to separate someone. Separation conflicts correspond to the epidermis, the lining of the milk ducts, and the periosteum. The epidermis of the left side of the body and the milk ducts in the left breast are controlled from the right side of your sensory cortex, and the epidermis of the right side of the body and the milk ducts in the right breast are controlled from the left side of the sensory cortex. Equally, the periosteum of the left side of the body is controlled from the right side of the postsensory cortex, and the periosteum of the right side from the left side of the postsensory cortex. A person's biological handedness and whether the conflicts are mother/child related or partner related determine on which side of the postsensory cortex the conflicts register in the shape of a brain edema. The constellation is established when the second conflict impacts the opposite brain hemisphere, and the conflicts can also occur. With a localized separation conflict that affects both sides of the body, the person is instantly in such a constellation. And this type of constellation can be permanent or recurring due to the tracks or conflict relapses. The postsensory cortex constellation manifests itself as short-term memory loss, and this short-term memory loss blocks the memory so that the individual can cope better with the separation. From a biological point of view, a separation from the pack is one of the most traumatic biological conflicts. In nature, being separated from the group usually means death, and we as humans share this distress with all other species. Short-term memory loss occurs with a single separation, and the symptom is more evident in a constellation. Additionally, the degree of the short-term memory loss is proportional to the intensity of the conflict. The brain scan here at the bottom right shows a post-sensory cortex constellation with a focus on the periosteum relay of each brain hemisphere, as you can see, and the impact of the conflicts compromises the synapses that pass the electrical signals, so the information from one neuron to another, and this causes memory impairment. The short-term memory loss reaches the healing phase because the swelling, so the edema in the conflict-related brain relays, continues to delay the transmission of nerve impulses between the brain cells. And as the healing phase continues, your condition returns to normal. When children suffer from poor short-term memory, it is nowadays considered to be one of the symptoms of ADD or ADHD, if the child happens to be hyperactive also at the same time. The concurrence of memory problems and hyperactivity indicates two coinciding constellations. One is related to separation conflicts and the other to conflicts of feeling stuck, also known as a motor cortex constellation. Often, the learning difficulties start after the separation from one of the parents or both, or after a move or a change of school that involves separation from schoolmates and friends, after a new sibling is born who gets more attention, or after the mother goes back to work, or when the parents constantly argue or are too busy to spend time with their child. In conventional medicine, an ADD diagnosis might also be made when the child is depressed, so suffers from poor concentration, or is manic depressive with a dominance of the depressed mood. Just like a hyperactive disorder diagnosis might be made when the child is manic, so inattentive and easily distracted. Separation conflicts experienced in the infancy or early childhood are often the underlying cause of dyslexia. When the elderly start to become forgetful, it is usually regarded as the first sign of Alzheimer's disease or dementia. According to the guidelines issued in 2019 by the World Health Organization, quote, getting regular exercise, no smoking, avoiding harmful use of alcohol, controlling one's weight, eating a healthy diet, and maintaining healthy blood pressure, cholesterol, and blood sugar levels helps to reduce the risk of developing dementia. Well, while all of this is good behavior and recommended to remain healthy, so you should get regular exercise, you should avoid drinking too much alcohol and smoking, etc., etc., we have no scientific proof for a clear connection between following all of these good guidelines, lifestyle advice, and not developing dementia or Alzheimer's disease. Neurologists argue that Alzheimer's is an age-related neurodegenerative disease that affects the functions of your brain cells. In contrast, brain researchers argue that memory impairment is caused by brain atrophy and enlarged ventricles. Brain atrophy, from a psychosomatic point of view, results from repetitive brain scarring processes due to continuous conflict relapses of any biological conflict. Additionally, these enlarged ventricles are linked to the choroid plexus and the distress of having difficulties memorizing. Hence, it is not the large size of the ventricles that causes dementia as suggested, but it is the other way around, namely that the short-term memory loss activates a biological special program that enhances the production of cerebral spinal fluid in the conflict active phase, which leads eventually to an enlargement of the ventricles. In conventional medicine, it is assumed that dementia is somehow related to plaque in your brain, even though the precise cause of Alzheimer's disease is still not known. Plaque is often found in the brains of people with Alzheimer's disease. These plaques are calcium deposits that form over time due to constant conflict relapses that interrupt the healing process. Here it is shown on both hemispheres of the postsensory cortex in the CT scan on the top right, and the area of the brain that corresponds biologically to separation conflicts. Typical separation conflicts are the death of a lifelong spouse, losing a partner or a friend, having little or no contact with the immediate family, so with your children or grandchildren, or moving to a senior or nursing home. When this abandonment or refugee conflicts and the separation conflicts occur together, or concurrent kidney collecting tubules constellation adds confusion and disorientation to the memory loss. And the result is the typical clinical picture of Alzheimer's disease. Additionally, behavioral changes such as belligerence, social withdrawal, or depressed moods indicate further conflicts and additional constellations. Next, let's look at a very interesting study from 2001 performed on nuns and what it shows when it comes to the development of dementia and Alzheimer's and its causes. But before we do that, short reminder, if you enjoy our content, please support us directly by becoming a patron from as little as $5 per month. Link is in the description box below. Also, do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. For the holistic care you need and deserve, please contact us at christine.doctor. We take care of you remotely, so wherever you are in the world, we can help you. And check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Links are also, of course, in the description box below. Alright then, what about this study on nuns? In 1986, David Snowden, an epidemiologist at the University of Kentucky, began a research project known as the Nun Study. His investigation aimed to determine the causes of Alzheimer's disease by focusing on a group of 678 Catholic sisters who are members of the School Sisters of Notre Dame congregation in Mankato, Minnesota. And the participants were aged between 75 and 107. Why did he choose nuns? Well, because they lead a very homogeneous lifestyle and they live in a very consistent environment, and this makes them an ideal population to study. In addition to the assessments of their medical records and regular testing of their physical as well as cognitive performances, the participants also agreed to donate their brains after their death for research purposes. And the outcome was remarkable. The post-mortem examination of the nuns' brains revealed that many were showing pathologies of Alzheimer's in their brain, even though the sisters never exhibited signs of memory loss during their lifetime. Additionally, researchers in the field of brain plasticity suggested that the nuns' mental activities favored the development of new neural networks that eventually assumed the work of the degenerated brain cells. We take a different approach based on the findings that every disease is caused by a biological conflict. The memory decline, as seen in Alzheimer's patients, does not originate in the brain but in the psyche, precisely from the lasting separation conflicts that lead over time to dementia and Alzheimer's disease. And hence, the plaques found in the brain are not the cause of the memory loss, but the result of a continuous repair process in the conflict-related brain relays. If the person manages to resolve the separation conflicts, the memory function returns to normal. The plaques, however, remain. And this would explain why there are people like the Notre Dame sisters who had and have pathologies, so the plaque of the Alzheimer patients in their brains, while their memory is fully intact. So this nun study, from our point of view, confirms the GNM understanding of this whole situation to be correct. The School of Notre Dame sisters are living in underprivileged conditions. They lead their lives in a supported community where they share their activities and constantly engage in conversations with each other. It's like a family. The monastic community provides an ideal environment, therefore, for coping with the separation conflicts we experience, such as the loss of a sister in their case or the death of a family member. In addition, they are spared from moving into a senior home when they reach old age, And it is a reminder of generations when the elderly were living with their families and were cared for by their families until they died. Let's look at some recent research on diagnosing Alzheimer's, or the first indicators of Alzheimer's disease. In a new study, scientists at the Karolinska Institute in Sweden explored the timing and performance of plasma biomarkers in mutation carriers compared to non-carriers in autosomal dominant Alzheimer's disease. And their study showed that a protein called GFAP is a possible biomarker for the very early stages of Alzheimer's disease. The scientists examined 164 blood plasma samples from 42 relatives without inherited pathogenic risk and 33 mutation carriers for their investigation, and the information was gathered between 1994 and 2018. And their results reveal evident changes in several blood protein concentrations in the mutation carriers. One of the authors, Caroline Graf, professor at the Department of Neurobiology and Care Sciences and Society at the Karolinska Institute, said the following, quote, "The first change we observed was an increase in GFAP, which stands for glial fibrillary acidic protein, approximately 10 years before the first disease symptoms. And this finding about GFAP improved the chances, according to her, of an early diagnosis." So the results suggest that GFAP, a presumed biomarker for activated immune cells in the brain, reflects changes in the brain due to Alzheimer's disease that occur before the accumulation of tau protein and measurable neuronal damage. In the future, it could be used as a non-invasive biomarker for the early activation of immune cells, such as astrocytes in the central nervous system, which can be valuable for the development of new drugs and diagnosing cognitive diseases. This increase in GFAP was also followed by increased concentrations of p-tau181 and later NFL, which stands for neurofilament-like protein, which we already know are directly associated with the extent of neuronal damage in the Alzheimer patient's brain. In postmenopausal women, estrogen depletion causes also excessive elevation of nitric oxide in the brain and thus generates so-called SNOC3. And this SNOC3 triggers activated microglial cells, the innate immune cells in your brain, to phagocytose or eat neuronal synapses, which are the connections, of course, that mediate signaling between nerve cells in your brain. This aberrant chemical biology process results in synapse loss, which leads to cognitive decline in Alzheimer's disease. Surprisingly, female Alzheimer's brains had SNOC3 levels that were more than 6 times higher than those of male Alzheimer's brains. Alright then, now that we've discussed the causes and some ways in which we can detect quite early the development of these chronic degenerative diseases such as dementia and Alzheimer's, let's concentrate on natural holistic therapy strategies. The objectives of Alzheimer's disease treatment are, of course, to stabilize and slow the disease progression, reduce mental and behavioral symptoms, and improve overall quality of life. The therapy can be performed with medical drugs, herbal and natural remedies, and different neurogenesis procedures that we're going to look at. We, of course, are holistic healers and therefore prefer the herbal and natural remedies as well as supplements and the neurogenesis procedures that we're going to shine a light on. The treatment has only one target, the patient's healing, of course, and this is possible in our point of view if the causes of Alzheimer's disease are known and are targeted properly and accordingly. And as mentioned, we can help you with that. Contact us at Christine.Doctor. Link in the description box below. Alzheimer's disease in its initial stage is characterized by a short-term memory deficit, personality changes, and difficulties in attention or concentration. The progression results in increasing symptoms of memory deficit, mood disorders, delusions, and hallucinations. Movement difficulties and conditions of sleeping and eating may also start occurring, and in the advanced stage, the disease manifests with self-consciousness loss, as well as auto and all psychic disorientation, and substantial neurological changes resulting in epileptic seizures, myoclonia, or postural stability difficulties. Dementia developing in the course of the disease progresses from mild through moderate to an advanced stage where the patient becomes incapable of independent life. The factors that influence the development of Alzheimer's disease, the most common type of the dementia, by the way, are, according to medicine, genetic as well as environmental factors. For example, apolipoproteins E lead to irregular amyloid beta aggregation. Additionally, mutations of the genes such as HLA, DRB5, DRB1, INPP5D, MEFLC, PTK2B, etc., as well as FERMT2, may also induce the dysfunctions of the brain physiological processes. Other factors such as hypertension, obesity, diabetes, blood circulation disorders, oxidative stress, and inflammation also influence the progression of Alzheimer's. People over 65, especially postmenopausal women, are more predisposed to developing Alzheimer's disease. In Far Eastern medicine, Alzheimer's disease is mainly related to qi, blood, and organ blockages of different channels, especially the lungs, the spleen, the kidneys, and the liver. And blockages may occur due to phlegm that clogs up the orifices as well. All meridians start in the feet and end in the head, so they strongly influence your brain. One of the possible causes of Alzheimer's disease, according to TCM, is a lung and kidney deficiency. Symptoms here are chronic coughing with a sparse sputum that is difficult to expectorate, shortness of breath, spontaneous perspiration, a dry mouth and tongue, palpitations with a stifling sensation in the chest, fatigue, irritability, thirst, a dry throat, insomnia, as well as a listless speech. To treat the lung and kidney deficiency, we want to use formulas that generate the pulse powder to augment the qi. Also, we want to generate fluids, we want to clear the heat, we want to preserve the yin, stop the excess perspiration, treat the lung and kidney qi deficiency, as well as the heart and lung qi deficiency, the lung qi and the yin deficiency, the atrophy disorder, also known as the Wei syndrome, also that is caused by the lung heat with fluid deficiency, and we can achieve this with preparations such as RX, ginseng, tab, ophi, or porgonine, and schisandra, as well as other concoctions. As you can see, this formula has many other health benefits. It's great for coronary heart disease treatments, angina pectoris, pulmonary problems, cardiac failure, myocardial infarctions, heat strokes, asthma. The list goes on and on. The next possible cause is a spleen deficiency with a phlegm stasis. Symptoms here are memory loss, shallow complexion, fatigue, anorexia, all your four limbs feeling tired and heavy, abdominal and epigastric distension after eating, maybe acid regurgitation and vomiting, loose stools, and a shortness of breath. To treat the spleen deficiency with the phlegm stasis, we want to nourish the qi, strengthen the spleen, resolve the phlegm, and induce resuscitation. And one of the formulas that can help us achieve this is a pinalea decoction to drain the epigastrium and to purge the stomach. It also descends the rebellious qi, disperses the clumping, eliminates focal distension due to the cold and heat factors, the damp heat in the gastrointestinal area. It takes care of the goose syndrome, epigastric focal distension, the fullness and tiredness with very slight or no pain. Also the dry heaves, the vomiting, the borborygmus, diarrhea, anorexia, stomach pain, abdominal pain, subcardiac distension, the heartburn, the resistance below the heart, the soft epigastrium, nausea, ascites, and gargling sounds, and has also, as you can see, a whole list of other health benefits. It helps, for example, with acute gastroenteritis, atrophic gastritis, chronic gastritis, chronic hepatitis, early stage cirrhosis of your liver, etc., etc. Yet another possible cause is a spleen and kidney deficiency. Symptoms here are memory loss, the body is cold, the limbs are icy, the complexion is white and shiny, low back, knees, and the abdomen feel stiff and painful, the lower abdomen feels stiff and sore. You suffer from loose stools that contain undigested food, also from cock-crow diarrhea that occurs at about 5 a.m. in the morning, edema of the face and the limbs, dysuria, abdominal ascites, colon cold, spleen yang deficiency, a spleen and stomach deficiency, cold stomach, cold spleen, and kidney yang deficiency, as well as a tai yin deficiency with cold, severe abdominal and epigastric pain, cold body, diarrhea with undigested food, aversion to cold, cold and stiff or rigid extremities, reduced appetite, fullness in the epigastrium and abdomen, lack of thirst, maybe scanty urine with edema, nausea and vomiting, loose stools, trismus, constipation, gastric spasms, mild perspiration, maybe syncope, maybe also abundant clear urine. We have here two formulas that can resolve this issue. One of them is meant to nourish the spleen and the kidney, nourish also the brain and the bone marrow, warm the yang, dispel the cold, tonify the qi, and strengthen the spleen. And this formula contains aconite, ginseng, and ginger, amongst other ingredients. The second formula contains psoralea and myristica. It's meant to warm and tonify the spleen and the kidneys, to astringe the intestines, stop the diarrhea, that can be due to the spleen and kidney yang deficiency. And these formulas, again, as you can see, have a whole range of other health benefits. They help with memory loss, with a cold body, icy limbs, etc., etc. The heart fire flaring up can be another cause of your condition. Symptoms here are predilection towards rash behavior, ulceration, erosion, and pain of the mouth and tongue, thirst with a desire for cold drinks, headaches, irritability, irascibility, insomnia, profuse dreams, anxiety, a chaotic, confused speech, inconsistently laughing and crying, feeling of heat and disturbance in the heart, insomnia, a flushed face, red lips, a bitter taste in the mouth, frequent reddish urination as well as dry stools. To address this cause, we want to clear the heat, purge the fire, and guide out the red powder with powder of fresh Rehmannia and clematis stem to conduct the fire downward. This formula also clears the heart, nourishes the yin, promotes urination, relieves the Lin syndrome, the small intestine excess heat, the heat in the heart and small intestine channels, and the heart and kidney yin deficiency. So, the formula consists of Rehmannia, Akebia, and we also have another formula which contains Rehmannia and clematis stem. Those are to conduct the heart fire downwards, clear the heart, nourish the yin, and also promote the urination. And all of these formulas have, again, a whole list of other health benefits. They help with stomatitis, nightmares, acute urinary tract infections, cystitis, acute glomerulonephritis, herpes zoster, etc., etc. What if the cause is a phlegm, damp that mists the heart orifices? The symptoms here are mental confusion, heavy-headedness, a yellow, stagnant facial complexion, superficial edema, fatigue, lack of strength, hypersomnia, sound of the phlegm in the throat with gurgling, scanty or confused speech, alternating sorrow and joy for no reason, lack of discrimination between good and evil, no care for appearance, a profuse phlegm drool from the mouth, ductal oppression as well as abdominal distension. If it's a severe condition, you also suffer from lack of sensitivity and an inability to manage your activities. To address this, we want to strengthen the spleen, clear the phlegm, arouse the brain, open up the orifices, cleanse the heart, and also cleanse the heart. And for that we have again natural decoction that can also help with Alzheimer's disease, of course, what we're discussing here, and heart disease amongst other conditions. Heart and spleen deficiency is yet another possible cause. Symptoms here: confused, chaotic thinking, predilection to sorrow, a desire to cry, excessive stillness, scanty speech, slow movements, a lack of involvement in the outside world, lassitude, spontaneous perspiration, lack of strength, emaciation, palpitations, susceptibility to fright, shortness of breath on light exertion, a torpid intake, lack of taste. We want to address all of these symptoms and the heart and spleen deficiency that is the cause. And to do that, we must nourish the heart, calm the shen, and resolve the blood deficiency for the patients with a weak constitution or with debility in the wake of the illness. And we use here a formula that we call the Nourish the Heart decoction, which can also help you with absent-mindedness, poor concentration, heart arrhythmia, depressive psychosis, bipolar disorder, low-grade fever, schizophrenia, psychosis, anemia, etc., etc. Another possible cause is a liver Qi and blood stagnation with phlegm. Symptoms here: blurred vision, a quick temper, depression, oppression, emotional dysphoria, no desire to speak, rib and flank distension, and pain. To resolve the liver Qi and blood stagnation with phlegm, we want to spread the liver Qi and regulate the Qi, invigorate the blood, dispel the phlegm, and open up the orifices. And for that we use what is called modified Master Wu's liver stagnation formula. That has many health benefits, amongst which, of course, is also Alzheimer's disease. If the cause of your condition is a liver and kidney Qi deficiency, the symptoms are dizziness, vertigo, impaired vision, night blindness, tinnitus, agitation, restlessness, that you tend towards frantic activities, that you are irascible, you suffer from throbbing headaches with distended feeling, flushed face, blurred vision, red, dry eyes with a sense of grit in the eyes, dry mouth and throat with a bitter taste in your mouth, palpitations, headaches, nervousness, insomnia with a lot of dreaming, dry throat, thirst, the so-called five-soul heat, night sweats, light or late menses, a stiff tongue, amenorrhea, slurred speech, numbness and tingling in the limbs, maybe deviation of the mouth and eyes, hemiplegia, a sensation of heat rushing to your head, numbness, twitching and spasms in the extremities, a trembling tongue, convulsions, deviation of the mouth and the eyes, liver wind that is stirring internally, liver yang, so liver fire that generates wind, liver yin deficiency, also with liver yang rising. And the formula to address this is one that nourishes the yin, pacifies the liver, subdues the yang, arouses the spirit, opens up the orifices, calms the liver, extinguishes the wind, clears the heat, invigorates the blood, tonifies also the liver and kidneys, and it is a gastrodia and uncarrier decoction that has, as you can see, again, a whole range of other health benefits. As you can see already, there are many possible causes from psychosomatic to physical ones that can cause dementia and Alzheimer's. That's why you need a holistic assessment first and foremost before you can use any of the treatment methods. Contact us again at christine.doctor, link in the description box below, and we will assess you holistically and remotely. Okay then, next on our list of beneficial remedies is lion's mane mushroom. Why? Because researchers from the University of Queensland have discovered an active compound in this mushroom that boosts nerve growth and also enhances memory. Professor Frederic Meunier from the Queensland Brain Institute said the team had identified new active compounds in the mushroom known as Hericium erinaceus or lion's mane. They have discovered that these lion's mane mushrooms improve brain cell growth and memory in preclinical trials, and extracts from these lion's mane mushrooms have been used in traditional medicine in Asian countries for centuries. Still, they wanted to determine their potential effect on brain cells scientifically. And according to Professor Meunier, preclinical testing found indeed that lion's mane mushroom has a significant impact on brain cell growth and memory improvement. Laboratory tests measured the neurotropic effects of the compounds isolated from lion's mane on cultured brain cells, and surprisingly, the active compounds promote neuron projections extending and connecting to other neurons. Using super-resolution microscopy, they also found the mushroom extract and its active components essentially increase the size of growth counts, which are particularly important for brain cells to sense their environment and establish new connections with other neurons in the brain. Co-author Dr. Ramon Martinez Marmos said the discovery had applications that could treat and protect against neurodegenerative cognitive disorders such as Alzheimer's disease. He also said that their idea was to identify bioactive compounds from natural sources that could reach the brain and regulate the growth of neurons, resulting in improved memory formation. Dr. Da-Hee Lee from CNG Bio, which supported and collaborated on this research project, said the properties of lion's mane mushrooms had been used to treat ailments and maintain health in traditional Chinese medicine since antiquity. He also noted this critical research is unraveling the molecular mechanism of lion's mane mushroom compounds and their effects on brain function, particularly memory. Then we have huperzine A. What is it? It's a natural compound, one from Chinese clubmouse or clubmouse plant. It can also be produced in a lab. It increases the levels of a chemical called acetylcholine. In one of the studies on huperzine A, they state that they conducted this review to evaluate the beneficial effect of huperzine A for the treatment of Alzheimer's disease, and they found that it acts as a cholinesterase inhibitor, a type of medication that works by improving the levels of neurotransmitters in the brain. And early studies suggest that this huperzine A might improve memory and protect the nerve cells, slowing thereby the cognitive decline associated with Alzheimer's. Some studies have found evidence that huperzine A might significantly improve cognitive performance in people with Alzheimer's. In a meta-analysis, the scientists state that they searched for randomized clinical trials of huperzine A for Alzheimer's disease in PubMed, Cochrane library, and they found the major Chinese electronic databases from inception to June 2013. They performed the meta-analysis using certain statistical analytic software, and it delivered the following results. They looked at 20 randomized clinical trials, including 1,823 participants. In these clinical trials, huperzine A was compared to placebos and showed a significant beneficial effect on the improvement of cognitive function as measured by mini-mental state examination at 8 weeks, 12 weeks, and 16 weeks. They also looked at the so-called dementia scale, HDS, and a Wechsler memory scale at 8 and 12 weeks. Activities of daily living favored huperzine A as measured by the activities of daily living scale at 6, 12, and 16 weeks. One of the trials found huperzine A improve global clinical assessment as measured by clinical dementia rating scale. One trial demonstrated no significant change in cognitive function as measured by Alzheimer's disease assessment scale cognitive subscale, and activity of daily living as measured by Alzheimer's disease cooperative study activities of daily living inventory in the huperzine A group. Trials comparing huperzine A with no treatment, psychotherapy, and conventional medicine demonstrated similar findings. No trial evaluated the quality of life of the patients, and no trial reported severe adverse events on huperzine A. The usual starting dose is 100 micrograms twice per day, and you increase the dosage after 1 month to 200 micrograms twice per day. The dose of 200 micrograms is the one most often used in clinical trials. So, huperzine A appears to be yet another natural remedy that has beneficial effects on the improvement of cognitive function, daily living activity, and global clinical assessment in participants with Alzheimer's disease. Another potentially beneficial natural remedy is ginkgo biloba. It's a natural medicine for cognitive impairment and Alzheimer's disease. In one of the studies on it, the scientists say that they explored the effectiveness and safety of ginkgo in treating cognitive impairment and Alzheimer's disease. Again, it's a meta-analysis. They looked through PubMed and Cochrane library and also Chinese databases. And the results were they selected the 21 trials with 2,608 patients that met their inclusion criteria, and they state that the general methodological quality of the trials they looked at was moderate to poor, unfortunately. Compared with conventional medicine alone, ginkgo biloba in combination with traditional medicine was superior in improving mini-mental state examination scores at 24 weeks for patients with Alzheimer's and mild cognitive impairment, as well as activity of daily living scores at 24 weeks for Alzheimer's disease. When compared with placebo or conventional medicine in individual trials, ginkgo demonstrated similar but inconsistent findings, and it had no adverse events, or when they were present, they were very mild, according to the researchers. So, conclusion on ginkgo: it is potentially beneficial for the improvement of cognitive function, activities of daily living, and global clinical assessment in patients with mild cognitive impairment or Alzheimer's. However, due to the limited sample size, inconsistent findings, the problems with the methodology of the included trials, more research is warranted to definitively confirm the effectiveness and safety of ginkgo in the treatment of mild cognitive impairments and Alzheimer's disease. New cell formation in our brains is fascinating for two reasons. First, it is a mechanism by which neuronal networks change repeatedly, and it thus contributes to the plasticity of the brain, its ability to respond to environmental changes and adapt the organism's behavior. Secondly, it can be studied how the formation of new synapses in the brain regions are now signals available. If this should one day succeed, it might be possible to replace neurons in the brain that have been lost due to the diseases such as strokes and Alzheimer's or dementia that have led to the death. The death of these brain cells could also be caused, of course, by head injuries. So we first need to understand why new cells are formed in the two brain regions, and nowhere else to get closer to the significant goal than investigating how a completely undifferentiated stem cell develops into a neuron, performing specific functions in the neuronal network. It has become apparent in recent years that glial cells often act as precursors for neurons during embryonic development and in adult brain development in the adult brain. These glial cells typically perform a wide variety of tasks in your nervous system. They regulate cerebral blood flow, envelop the contact neurons from the insulating myelin sheaths around nerve cell processes, and much, much more. They also form the starting point for the development of new nerve cells, and this was unknown until recently. In 2000, a research group at the Max Planck Institute of Neurobiology in Martinsried, Germany, discovered that so-called radial glial cells serve as simple scaffolds for migrating neurons during brain development, and also most of the essential pyramidal cells in the cerebral cortex. At about the same time, a research team led by Fiona Deutsch and Arturo Alvarez Buya from Rockefeller University in New York also looked at stem cells from which the new neurons of the olfactory bulb in the adult brain develop. They were astrocytes, star-shaped glial cells, which are found in enormous numbers practically everywhere in the brain. Why can these cells in the olfactory bulb give rise to new neurons throughout their lives, while in almost all other adult brain regions they cannot do so? Well, this is because stem bulbs can produce undifferentiated cells that have not yet specialized in a specific task. So all doors are open to them, so to speak. In principle, they can develop into many different types of cells. At the same time, new stem cells are produced to ensure a steady supply. If this second process fails, however, the collection of stem cells is depleted and neurogenesis comes to a standstill sooner or later. Why am I telling you this about neurogenesis? Well, it's because recently researchers have been starting to work on methods to stimulate intentionally this neurogenesis, which could be another way to treat Alzheimer's and dementia. From one of the researchers' statements, nothing can regenerate seems true indeed, including the entire neocortex, which is the seat of our conscious perceptions and motor perceptions performance, if the neurons die here after being damaged, for example, as a result of a stroke. The new nerve cells do not replace them, but doctors are now pinning great hopes for attempts to stimulate this neurogenesis that we've discussed artificially. First, the researchers would have to reprogram the astrocytes in those regions to serve as stem cells and generate new nerve cells. And such fundamental development of cells is controlled by the action of the cell's master control genes. As a rule, these are genes for transcription factors, i.e. proteins, which in turn influence the production of many other proteins and in this way, act like a switch. If a stem or progenitor cell activates such an essential gene at the proper development, it selects one of many possible programs. It thus also seals its fate because all other alternatives are now eliminated. In 2008, researchers discovered that in the stem cell niches, the progenitor cells develop into neurons that produce the transcription factor DLX2. flipping the switch, it is possible to reprogram astrocytes into nerve cells by making their cells, getting them to read essential genes that usually guide the path from a stem or progenitor cell to a neuron. From the developmental neurobiology of the cerebral cortex, in addition to DLX2, several other so-called switch proteins are known, such as transcription factor neurogenin 2, while DLX2 usually leads to inhibitory neurons, neurogenin 2 normally leads to excitatory neurons. Quote from an interview with the researchers: to investigate this, they took astrocytes from the cerebral cortex of young mice in petri dishes and then inserted the critical gene, in this case neurogenin 2, into their nuclei. And indeed, some of the cells began to change externally over about 4 to 6 days and develop typical neurons. They then tested their electrical excitability, and lo and behold, unlike astrocytes, their transformed cells produced electrical action potentials. Proof that they are also functionally real neurons. We now know that these cells can form synapses, which are contact points through which they communicate. At least in culture dishes, they can also be integrated into neuronal networks. They still need to determine, however, whether this approach also works in an intact organism or in any organism, because so far this is preliminary research, as the researcher mentions, performed in laboratory conditions in petri dishes. But still, I think very interesting research that could lead to more. And I would like to end this presentation with yet another non-drug related method that is already being used in the field, and that it's called the eternal needle therapy. It originated from an accidental event. Dr. Worth, an acupuncturist, let the needle accidentally slip under the auricular skin of a patient at the trigeminal point, and he didn't notice it. Thus, the needle grew into this point of the patient. And this patient, who had previously suffered from trigeminal neuralgia and was also suicidal, came back after 3 weeks with the statement, "I have no more pain, I am cured." Unfortunately, after the inadvertently ingrown ASP needle was removed, the trigeminal neuralgia reappeared in full force. With regular acupuncture now in place, it took Dr. Worth 50 sessions for the condition to become more tolerable again. But the same success as with the ingrown needle did not occur again, and this made Dr. Worth very thoughtful. The idea of freeing patients from their disease with just one session never left him. The problem was that he could not replicate this effect with normal acupuncture, but of course, in order to offer such a eternal needle therapy, he had to first exclude the potential risks. So he looked for patients eager to try this new approach to examine the potential risk and to rule them out. So for example, that the needle starts migrating to other areas. So they used X-rays, superimposed the X-rays in many patients, and examined the tissue by also dissecting the implanted needle. Among the first patients was Parkinson's disease patients, in whom the corresponding area of the brain that degenerates in Parkinson's disease was treated. And this patient reported a halving of his Parkinson medications after just 6 weeks and showed also excellent mobility for a Parkinson patient. This patient appeared as a co-speaker at the World Congress of Acupuncture in Berlin on June 17, 2001 to report live on this completely unbelievable effect. And as time went on, it became clear that if a so-called incurable disease, such as Parkinson, could be reversed with this method, patients would be willing to pay a higher price for the therapy, and also thus other materials could be used. So they looked into different materials for these eternal needles, and only titanium came in question because it's sterile, it's also inert, and it's cheaper than, for example, diamonds. So they developed these titanium micro-ear implants, and they have also been approved in certain countries already as medical devices. During the MRI examinations, they found out that the titanium implants do not interfere with anything else, and they are also not visible because titanium is a non-magnetizable metal. As a result, at the airport, the detectors or the metal detectors can also not register the implant, so you don't have any problems there either. It doesn't migrate, by the way. They found out that it stays where it's implanted. So the risk, they also looked at the risk of infections and etc., and they found out it's really minimal. Of course, the patient must not scratch the ear for the first 3 days. No type of wound would tolerate scratching. But in the approximately 8,000 patients that have been treated with this method so far, rubbing the ear caused an infection in only 3 of them, and the infection was quite small and subsided quickly after antibiotics were administered. So even this risk is minimal. Before implanting the titanium tips, Dr. Worth makes a so-called needle plan, while the patient or his relatives report and are questioned about the complaints. The patient is clinically examined, and all findings, including those brought along, are collected. Dr. Worth then draws the points to be treated on pre-printed ear drawings. He determines the ideal number of micro-implants to the respective points, and he has more than 18 years of experience with this therapy, and the results are very, very promising. The number of needles per point corresponds to the severity of the corresponding symptom or disorder to be influenced, of course. So a very interesting method that is already being used successfully to treat many chronic conditions. That is an option, as you can see. With all that being said, I hope that you've enjoyed this presentation. If you have any questions, do not hesitate to contact us or comment down below. We will try to answer them to our best possibilities and abilities. If you enjoyed this presentation, I would also very much appreciate if you support us directly by becoming a patron from as little as $5 per month. Link is in the description box below. Also, do not forget to like, share, subscribe if you're not already, and comment to help the channel grow and spread the truth. For the holistic care you need and deserve, please contact us at Christine.Doctor. We will take care of you naturally, holistically, and remotely. And check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Links are also in the description box below. Thank you very much for your attention, and until next time, stay healthy.